Hello everyone. Today our video topic is antineoplastic agent. This one is a part of the medicinal chemistry. So medical term for tumor or cancer is neoplasm, which means a relative autonomous growth of the body tissue. So what is tumor? Tumor is a general term for any abnormal mass of growth of a tissue which is not necessarily life threatening. So there are two types of tumors. First is malignant and second one is non-malignant. So what is malignant? This one is known as cancerous tumor or potential danger. This can cancerous. And second one is non-malignant. As we see in our body, there are so many tumors exist, but they are not dangerous as so much. So these are non-cancerous tumor. It does not metastasize. According to the embryologic origin, the name of the cancer divided in sarcoma and carcinoma. What is sarcoma? Cancer arises due to from the abnormal growth of the mesodermal tissue. Is sarcoma. And carcinoma, cancer arises from the ecta or endodermal tissues. What is sarcoma? Before organs begin to develop from the early embryo of the multicellular organism, cell arrange them in three embryonic layers. First is ectodermal, mesodermal, and endodermal. Mesodermal cell form bone, cartilage, and muscles tissues. What is carcinoma? Ectodermal cells for skin and nerve tissue. Endodermal cells from the intestinal system is associated with the organ. So what is blood cancer? A cancer of the blood involving abnormal increase of leukocytes is called leukemia. Normal person WBC count this one, and with leukemia this one. Some cancers may name after the individual who describe the condition, such as the Ewing's tumors of bone, Leggett's disease, and some cancer name after the tissue of the origin, such as papillary. Tumor can be developed any part in the entire body. The unlimited of cells occur usually after the age of 30 and 40 years, but also occur in the younger. Cancerous tumor passes through the latent period, slow growth when systems are not obvious, rapid growth occur at age of 50 and late death. What is the mechanism of tumor? First is mutation, second is addition of new genetic material, third change gene expression, external causes of cancer, virus, chemical, or a radiation. Mutation. So what is mutation? Mutation is the loss of substance or arrangement of DNA in a cell. In 21st century, Boveri proposed a link between the substitution or rearrangement of the cancer. It is in several cases it has been seen that the tumor required to body in a genetic information can develop without change in our cell genes. So this one is same. The differentiated cell are randomly with undifferentiated cell are called embryonal carcinoma cells. This is malignant part of the tumor. Second one in the steps of this mechanism, addition of new genetic material. In chicken's virus is found that the cause of the cancer similar to the other virus produced cancer in mice, monkey, etc. Information of the tumor is the second mechanism as established, which include the addition of new viral genetic material into cell and genes. It causes the result of infection by tumor producing virus. And third one is change gene expression. In this, there is a permanent change in the endogeneity of the cell's genetic environment information. It is called epigenetic. If the generation of tumor is epigenetic, the tumor stage is reversible. What is the external cause of the cancer? Viruses, chemical, or radiation? So first one is virus. And this rose and finally proposed that the found of the virus which Peptin Rouse firstly proposed that the found a virus which caused a cancer in chicken. Not so proved that the virus caused cancer, but found in the breast cancer. Two viruses are useful in the cancer: papovavirus and adenoviruses. Papillomavirus, similar to the vacuolating 14, when virus eject in the monkey causes cancer but not affect in human. Adenoviruses, this is found in the upper respiratory tract of the most human. When it injected the newborn hamster, it develops a tumor within 2 months. Chemicals, wide number of chemicals can cause cigarette compound of beryllium, cadmium, nickel, chromium 10 a cause of a cancer in the human, as long time inhalation of the asbestos particle produce a rare type of the cancer. There is a some number of polycyclic aromatic hydrocarbon known as carcinogenic compound. Benzenopyrene, 2-naphthylamine, 2-acetylene fluorine, dialkyl nitrosamine, and last one is radiation. Radiation is the increase of metastasis of existing tumor. There is a few number of the natural occurring radioactive element which called carcinogenic in nature, uranium, thorium. Atomic bomb explosion in the Japan caused blood cancer. Treatment of cancer: surgery, phototherapy, radiation therapy, immunotherapy, and chemotherapy. First one is surgery. If the tumor is not metastasized, it can be removed by the surgery. A small tumor has been spread. All of the organs cannot be treated successfully by removing a primary tumor. Second one is photoradiation tumor. Tumor can be localized and destroyed by making a use of selectivity of fluorescence of the hematofluorin derivatives. HPT injecting the cancer patient to the locate the tumor. After centrifugal, the injection of the fluorescein can absorb the tumor tissues by use of the probes and fiber optics to destroy the tumor. Light from the tunable dye laser in the wavelength into the tissue. Radiation therapy, it is destroy the tumor effectively. It is known as only minimal damage to the surrounding of the normal tissue. That's why the superior than the surgery. Radiotherapy is the destroy microscopic cancer cell which is present in the lymph nodes. If the radiotherapy is performed before the surgery, it can reduce a large number of tumor and decrease the chance of metastasis. In the theory, gamma rays generated from the radioisotopes such as the cobalt 60, where X-ray is produced from the specific instrument. These electromagnetic waves are absorbed by the all types of the living cell and harmful for their narrow aimed and the tumors of different size. Last one is chemotherapy, BCG immunotherapy. Used after the chemotherapy produce the re-emission of much greater of the duration of the chemotherapy alone. By the surgery, radiotherapy, or chemotherapy, the body's own defenses may be stimulated by the immunotherapy to destroy the large few cancer cells. This is remain after the surgery. And last one is chemotherapy. It is a treatment when antineoplastic drugs are allowed to penetrate in the body, which act as a clump of the cell that may be lost in the other cells. Chemotherapy results in the common side effect like